So today I wanted to talk about another disorder that is connected with OCD behaviors. It's also connected with anxiety, and it is classified technically as a body-focused repetitive behavior and an impulse control disorder. It is called trichotillomania, and I guess the non-technical term for that is called hair pulling. This is people who pull out hair either from like the top of their head, sometimes their eyebrows, eyelashes, those kind of things, in kind of an obsessive manner or as a coping mechanism quite often for symptoms of anxiety. So I'm going to read from the DSM, and I'm going to read kind of the 5 criteria that they identify, and then I'm going to talk a little bit about some of the treatment options and how you can deal with whether you have trichotillomania, a family member, or I've seen trichotillomania in really young children as well, so maybe your children are dealing with this too, and what are things you can do to help them. In the DSM, trichotillomania is defined as recurrent pulling out of one's hair resulting in hair loss, repeated attempts to decrease or stop hair pulling, so you've tried to stop but you just can't, or you're really struggling to. Number 3 is the hair pulling causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. Number 4, the hair pulling or hair loss is not attributable to other medical conditions. So this might be things like alopecia, other dermatological conditions, like itching, scratching, bites, those kind of things. That would not be considered as trichotillomania, or if you're kind of itching because you have issues with your skin or with bites or all of those things, that is not necessarily a mental health disorder. And number 6, the hair pulling is not better explained by the symptoms of another mental disorder. For example, attempts to improve a perceived defect or flaw in appearance in body dysmorphic disorder. People with like body dysmorphia who maybe don't like their hair or are trying to make themselves look better in a certain way, those kind of things, that they would not fall under a diagnosis of trichotillomania. So one important thing to know with trichotillomania is that sometimes hair pulling can be accompanied by other behaviors or rituals, especially if it's kind of connected to OCD behaviors. Examples of this might be that there's only particular kinds of hair, particular places that they'll pull hair from. People who pull the hair might also have other behaviors attached to this, so they might put the hair in their mouth, they might roll them around in their hands. It might be kind of a sensory thing for them. Some people I've even heard of who will chew the hair and actually eat it. So it is quite a serious disorder, like especially if children are eating the hair, just because it can build up kind of inside them too. Now, the biggest trigger for this type of behavior is usually a stressful life event. It can also be just a result of anxiety or boredom. We've examined trichotillomania and the fact that it's a very unpleasant diagnosis for people. What are some of the treatment options? Treatment for trichotillomania primarily would revolve around kind of behavior reversal. So this would be more long-term therapy where we replace the hair pulling behavior with a more positive or less harmful behavior to the self. Something like every time you feel like pulling your hair out, you would clench your fists. And you would do this kind of repeatedly until that becomes your natural response to feeling stress or anxiety or this urge to hair pull. It might be something more extreme, like I go for a run around the block, or I do 5 sit-ups, or I jump 5 times. Depending how severe your problem is and needing to find a behavior that matches the satisfaction that the hair pulling gives you will kind of depend on the behavior reversal method that you need to use and how long it's going to take for that behavior to be reversed. Don't beat yourself up if you do slip back into the hair pulling at times, but keep working on that behavior reversal until it becomes a second nature to do the behavior that isn't the hair pulling. The next one that I would suggest is cognitive behavioral therapy. So cognitive behavioral therapy helps you to examine cognitive distortions, or what in kind of layman's terms is called thinking errors, and to examine your behavior and why you do it. So the triggers behind it, what's causing you to want to do that. Sometimes with hair pulling, it's just a really satisfying thing for people, or it's a coping mechanism for dealing with anxiety, stress, and all of those other issues that come up for us when we've had trauma, life stressors, and other things like that. And another one that is kind of suggested is acceptance and commitment therapy. So that is more a therapy where you learn to accept behaviors and accept urges that you have without having the need to act on them. That can be a really great method as well for dealing with something like trichotillomania, which is hair pulling. With kids, other methods are like things like wrapping fingers so they can't pull hair, letting them wear a hat, having sensory issues. I've also given kids like brushes and things like that to play with, or fidgets if they need something to do with their hands. Those are my suggestions. If you need help with anxiety or practicing mindfulness, which is another great practice for becoming more self-aware and learning how to take control of our behaviors, then please download my free therapy guide, and I will put a link to that below as well. Thanks so much for watching, you guys, and I will see you next week.